Well, good afternoon. We'll begin our briefing today on November the 17th. We hope this information is helpful to you, and we hope, of course, we repeat it every day, and sometimes repetition, it sinks in, but the numbers on today's report you'll see took an uptick, and with Thanksgiving and Christmas coming up, the last thing that any of us want is for any of our citizens to be sick or to get someone else sick. So please, please, please pay attention to the protocols and the precautions that are needed. We don't want to, what I'm hearing on the national level, talking about, cancel Christmas, cancel Thanksgiving, that's not going to happen. But what we want to make sure of is that when you have a time with your family, both at Thanksgiving and Christmas, that you're safe going into that festivity and you're safe when you come out. So please take the extra caution and be very careful. Unfortunately, someone related a story to me that they'd gone to a luncheon last Thursday and they'd taken the precautions at that luncheon, 4 people to a table. They got a call Friday that one of the people at the table tested positive. Given the head temperature test check, went through the questions going into the luncheon. But Friday, one of them tested positive, and so the other 3 are now in quarantine. So you just don't know. You've got to be very careful. So please, please, please pay attention. The only time you want to see a graph look like these last 3 days right here is if you happen to be in the stock market. We're not in the stock market. So you don't want to see these lines keep going up. We want them to go down. And so the information that will be provided by the judge in just a moment, and Annette, and then Dr. Bird, they're not coming down here just to have an opportunity to speak to you. They're coming down hopefully to try to keep our community safe and to remind you. Hopefully we have some new people that have not been watching in the past, some that have been watching in the past and just picking and choosing what they wanted to hear, but we're sincere about our effort. There's no interest whatsoever on my part or the judge's part or anybody else's of saying we're canceling Thanksgiving, we're canceling Christmas. We don't want to do that. But we want to make sure you're safe and that we're safe. So please pay attention to those. I'd call on Judge Canales now to come and make her remarks. Is it, Judge, are you coming or is it Annette coming? You're coming? Judge is next? All right, good. But and Judge Canales, I think, will reaffirm our commitment to trying to keep you safe. We're doing everything we can, and so we're trying to work together to keep Corpus Christi and Nueces County safe and get you on the downside of this pandemic as opposed to the uptick side. So, Judge.
Las cifras diarias han estado aumentando, por lo que le pedimos continuar tomando sus precauciones, especialmente durante las festividades. No le estamos pidiendo cancelar, solo que tome sus precauciones. La juez Canales, la directora del Departamento de Salud y la Universidad Texas A&M le van a dar información pertinente. Lo único que queremos es de que usted y su familia estén seguros. A continuación, la juez del condado, Bárbara Canales, nos va a dar su reporte.
Thank you so much, Mayor. You're absolutely right. I echo everything you said about how important it is to stay vigilant. I'd like to address some important issues. One I told you about, that I really care that we make certain that we know what our resources are in this community, and that's our mental health resources and its nexus to COVID-19. I'm also going to begin to talk about some news that came out of the Texas Supreme Court that affects our jury trials and our eviction proceedings. Then I'll give a little bit of a holiday health reminder and talk about our public messaging that we're very thankful for because it provides some really great tips. And then we'll end off with, believe it or not, we're still in election season here in Corpus Christi. in Nueces County. We have some runoff election safety to go over with you. So first, let us begin with the Texas Supreme Court and these emergency orders. There were two that were issued late on Friday that relate to COVID-19. And we get a lot of calls at the county about eviction hearings, and so I'd like to update you now. This, of course, is extending a previous order that outlined limitations on jury trials from February 1st, to February 1st, 2021 from December 1st. So we were on a stay, no jury trials until December 1, and now our Texas Supreme Court has given us the word that we're going to extend now to February 1. So no jury trials in Nueces County or any other county in the state of Texas unless by special exemption will take place. Of course, we're going to be using all reasonable efforts to hold proceedings remotely. I can tell you that we have done an amazing job having essential hearings throughout Nueces County, and I want to personally commend District Judge Nanette Hessett for issuing an order that implements this particular Supreme Court order for Nueces County. There was another order. This court extended deadlines for procedures for tenants to apply for the Texas Eviction Diversion Program. This is a statewide assistance program. It's intended to help tenants who are behind on rent due to COVID and really just avoid evictions. So Texans could be eligible for this rental assistance and other services that are offered through local providers outside the eviction process. The Supreme Court did establish this program through the 27th emergency order. Now, with funding that has come down from Governor Greg Abbott's office through the Texas Department of Housing and Community Affairs, the program is really aimed at reduction of the number of evictions by enabling landlords and tenants to agree upon resolution to non-payment of rent issues. Now, I bet you want to know more about this program and you don't have a pen and you're just trying to listen. Let me tell you where you can go to get all of the information that you need regarding this Texas Eviction Diversion Program. It's at txcourts.gov, and I'll make sure this is on our website so that we can, just give us a day to make certain that we can link this up. But txcourts.gov, and I think it might even, I'm actually getting a little bit of a link a message that's already on our Nueces County website. So you don't have to look very hard. Anyway, that is important information. Anytime the Supreme Court gives us an order that affects our court system, I will be bringing you that news to make sure that we're all in sync. Now, let's talk about mental health. I mentioned this last week, and I want to stress the importance of the coronavirus pandemic and its impact on mental health. There's no doubt that this is a very stressful time for people in so many different ways, and it's a combination of fear and anxiety. There is so much emotion regarding our children in schools, and adults can often find themselves overwhelmed. And so even the very thing that we tell you to do is somewhat counterintuitive to mental health, like stay away from people, social distance. This can make us often have thoughts of loneliness and increase our stress and anxiety. But of course, we need to do these things. So how can we create this balancing act? Well, I want to make sure that I repeat some of the items that I talked about last week because these come straight from our mental health experts. And Nueces County is very proud of our behavioral health programming and our collaboration with mental health and intellectual disabilities. So if you feel any of the following, it could be a very big sign of stress. So if you have changes in your sleep and eating patterns, difficulty concentrating, your health problems are worsening, and you just have an abundance of fear and worry about your own health, the health of your loved ones, or any type of financial situation regarding COVID-19. If you see loved ones or yourself involved with an increased use of tobacco and or alcohol or any other substances, all of these are things that are very much related to stress. And so how we respond to it in this pandemic can really vary as well. There's so many different factors from, economics to health equity, social support. I could go on and on. But what I want to know is that there are many of us that can find ourselves at risk. And people in particular who are higher risk for severe illness from COVID-19 could also find themselves at risk for mental health concerns. So I want us to be thoughtful about those that are the most vulnerable, including our children and our teenagers, people who are frontline workers who are really have just been on the battlefield for too long now, and people who are caretakers, who are caring for family members. There are so many different, genres of folks that could find themselves in this category, people who live with disabilities. And so chances are, if I listed all these categories, we know somebody who falls right in those categories. So what can we do? And I think that one of the things is that if we are to be honest, the first thing you need to do if you've been diagnosed with COVID-19 and you really have a concern, we want you to call our COVID-19 clinic. We want you to have the expertise of a healthcare professional who has been really set up for this very purpose. And we want to remind you that this clinic is free and it's available for those of you who have insurance, who don't have insurance. You just need to have been tested positive for COVID. And so we can get you the care that you need and help manage your symptoms at home. And we hope this will reduce your stress, reduce your anxiety. And I really want you to use this resource. If you or your family have been diagnosed with COVID-19 in the past and you're worried about late-term effects, or you have an active case now, or you're still in recovery, please call our COVID clinic at 826-8019, 826-8019. We want to make sure that your physical health supports your mental health. And I think that there is lots of avenues for opportunities, and we want you to continue to use our office as a resource for you, and that's 888-0444. It's long been said that your emotional health is as important as your mental health, so taking care of that aspect of wellness is going to keep us all stronger. So here are the tips that came straight from our behavioral health experts at the county, and I will read them to you. And I'm personally looking to do all of these myself, and that's take care of your body, take deep breaths, stretch, meditate, try to eat healthy, try to exercise regularly, get plenty of sleep, avoid excess alcohol and drug use, make time to unwind, and connect with others in the healthy way, and talk about your concerns and your feelings. And I want you to absolutely reach out to people with all the ability you have through the telephone and through technology. And don't forget, reach out to somebody, ask them how they're doing. Even if you think they've got it all together. One of the greatest gifts that I get every morning when I walk into my office is somebody, a member of my staff says, "How are you today?" We all have the same human emotions. And so we're all connected, and we need to make sure that we are asking people that we care about how they are doing. Ask them if they need anything. Ask them how they're feeling. And tell them very much, if you haven't been able to connect with them, that you care about them and that you miss them, and that if they need things, that there is some way that we can get help, because our community is about helping others. And so I know that there are a lot of charitable organizations that are available to us, and I want us to reach out and take care of one another physically and mentally. And again, just because maybe you've recently tuned in, that number for our COVID clinic, keeping our physical health is going to get us our emotional health, and vice versa. Staying strong emotionally and well is going to take care of our physical body. And that number is 826-8019. But make no mistake, if you feel like you or anybody of your family is suffering from a mental health crisis, we want you to call 911, and we want the experts to be able to assist you. So I just want to talk about quickly that the safest option for our holidays is to celebrate only with those living in your household. And if you're planning a gathering, we want you to follow the CDC tips that are available, and I want you to get on noisesnose.com, and really read some of the great guidelines that have been provided to you by our health experts. It's live website. It's got so much information, how to celebrate safely. And I want you to share with me how you creatively made this holiday a joyous one, given these very, very difficult times. I think that the hardest part for me and my family is that our kids are going to come home from college. And so we are going to be announcing a lot of testing sites in the next coming weeks, all the way through the month of November. Please test if you feel like somebody has been exposed to COVID-19 or is experiencing symptoms, and do not wait, and make sure you isolate. And I know this is going to be really hard for our very connected familia that we have here in South Texas to just celebrate in small groups. But if we do this, if we learn how to share the moment safely and make certain that our traditions this year are preserved to share next year at that dinner table, I think we will have something to be truly celebrating in 2021. But we're going to need your help. And again, I needed to know what the tips were. So I got on noisesnose.com, and I'm very thankful that there are opportunities to share with all levels of our family, from our youngest to our oldest, on how we're going to make this the best Thanksgiving ever. You might say, how could it possibly be the best Thanksgiving, Barbara, if we're not going to be with the people that we love? It's because we're doing it for the people we love. And there's no greater giving than that gift of sacrifice for the love of another. Okay, not so serious, but still very, very critical. We did a good job in voting safely in 2020 on November 3rd, but we have a runoff election. Sometimes we need our muscle memory to come back. So we have a runoff election for 3 important positions, and a lot of people will be going to the polls because it's a citywide election: mayor, City Council District 1, and City Council District 4. And that means we're going to have a lot of people moving about. So it's really important that on this runoff election, which is slated from, early voting is slated from December 7th, which is a Monday, to Friday, December 11th, and then Election Day is Tuesday, December 15th. We will be out again in force promoting voter safety. So look for our signs. Look for our website, votesafenoises.com. We will link it on everything that we have that's city, county, public health. And as we did for the general election, you have to keep the message current, and you've got to repeat what we already know. That's what we call strengthening our message, creating resiliency. And so I want to make certain that in this very, very pivotal time between the holidays of Thanksgiving and our December holidays and our runoff election, that we do everything we can to keep those numbers as low as they can go. And if we do that, then we will be giving the greatest gift of all, which is that our healthcare providers will get the break they so well deserve. But right now, there are no breaks and there are no rest for the weary. We are in full stop, complete vigilance mode. And we're praying that this holiday season, you will be our partner in not only celebrating safely, but voting safely as well. Thank you, and we look forward to working with you. And again, please reach out to Nueces County if we can be of help, whether it's mental health resources, voting or election resources, or just making certain that you have the right phone numbers and the right websites. We stay vigilant and willing and ready to serve.
La Corte Suprema del Estado ha emitido órdenes de emergencia. La primera limita los juicios en persona hasta el 1 de febrero. La orden va a estar vigente en nuestro condado. La segunda, la cual también ha sido adoptada por la juez, Nanette Hassett, extendió una orden para los desalojos. Así las personas afectadas tendrán más tiempo para participar en el programa en contra de los desalojos. Para más información puede encontrarla en la dirección txcourts.gov. En cuanto a la salud mental, las acciones que se han tomado, como el distanciamiento social, puede hacer que la gente se sienta aislada o experimenten ansiedad. Además, la situación puede ser estresante. Cada persona reacciona de manera diferente en situaciones estresantes. Las personas que están en mayor riesgo a experimentar estrés son las personas mayores de edad, adolescentes, personas que cuidan de algún familiar y empleados de salud, entre otros. Afortunadamente, contamos con la clínica ambulatoria que le puede ayudar a sobrellevar esta pandemia. Se le pide llamar al 826-8019 si necesita de ayuda. Los días festivos están a la vuelta de la esquina. Muchos estudiantes van a pasar estos días en sus hogares. Como sugerencia, planee tener reuniones virtuales o celebre solamente con su familia directa. Para más consejos, puede acudir a la página nuecesknows.com, en donde obtendrá más información. Finalmente, en cuanto a la elección de desempate, son 3 las posiciones que aún se debaten en las urnas. Estas son las posiciones de alcalde, la de concejal del Distrito 1 y del Distrito 4 del Ayuntamiento de la ciudad de Corpus Christi. El ganador debe obtener más del 50% de los votos para obtener esa posición. La votación por adelantado se va a llevar a cabo del 7 de diciembre al 11 de diciembre. El día de elección es el martes 15 de diciembre. Y como ocurrió durante la elección, estamos tomando todas las precauciones necesarias para que usted vote de manera segura. Más información está disponible en la dirección votesafenueces.com. Ahora la directora del Distrito de Salud, Annette Rodríguez, nos va a dar su reporte de las cifras más recientes en casos positivos.
Thank you. Annette Rodriguez, Health Director. Thank you, Judge, especially for talking about the mental health. And we also have Dr. Lucens from the Nueces County Medical Society who will speak following me, and he will talk more about pandemic fatigue. It's real, and we're all feeling it. It's been 9 long months of this, and so thank you for joining us today at the press briefing. So I'm going to start out with the statistics this evening. Thank you. And so if you look at the statistics for the daily COVID-19 cases for the last 2 weeks, you see that bobbling I've been talking about, 44, 73, 55, 33, 7, 123, 120 cases a day, 56, 85 cases, and now today, 78 COVID cases today. These are active COVID cases here in Nueces County. Next slide, please. This is the donut diagram, if you will. We have a total of 22,338 COVID cases in Nueces County since our first case in March, cumulative. Of those 22,338, we have 20,957 that have recovered, but we still have 915 that are active cases. And we know that this number increases exponentially. So again, there is our concern there. And of all of the cases, we've had 466 deaths with no deaths reported today. Next slide. The hospitalizations is also very concerning at this point. So we had just gotten to like 50 cases, and so we were hoping that we could get like everybody or as many people, recovered completely and out of the hospital. And now in just a few weeks, we have over 100 patients with COVID-19 that are currently hospitalized in Nueces County. We're at a total of 105 hospitalized today. This is an additional strain to the hospital, and so we need to be very careful about the cases and doing everything that we need to do, like the judge mentioned, just being vigilant, not giving up. This is not the time to give up. We're getting close to receiving vaccines, so we need to stay the course. Next slide, please. The ICU patients, the COVID ICU patients, seems to be staying fairly steady, even though if you go back 2 weeks, we were at 23, and then today we're at 33. So it has crept up over the last 2 weeks, and we're at 33 cases. These are individuals that require more than just the regular hospitalized med-surg care. They require additional care that puts an extremely burden on, again, hospital staff. Next slide. These are the daily COVID-19 fatalities, and these are from November 4th to November 17th. 16 deaths in the last 14 days. And so again, we're starting to see, not only the cases that are increasing, also the hospitalizations that are increasing very quickly. We had that lag before, and now we're also seeing the deaths increasing. Next slide, please. And this is the bell curve that we usually end with, and this shows you the cumulative cases from June 2nd all the way to today. But if you look over here at this, we all know that in July was when we had our first peak, our first wave. But if you look over here, we're starting to see what we think is the second wave of cases. And this is the part that's very concerning. It looks very small right now, but we do not want to see that happen again. So moving to some of the health district activities that are going on currently. We believe, again, we've entered the second wave of the COVID-19 pandemic. It's important to stay aware and proactively avoid the spread. I applaud everyone who is practicing recommended public health strategies by wearing their mask, diligently hand washing, and consideration to the rest of the community. 2020 has brought upon us many difficult trials and tribulations, but we must continue to do everything in our power to protect each other. We had a drive-through this morning. We had 141 that went through our drive-through. 32 tested positive for a positivity rate for that drive-through of 23%, which again is on the increase. An important strategy that's helpful in preventing the spread of COVID-19 is a mask or face covering. In July, the governor of Texas issued a mandatory mask requirement in the state of Texas. This mandatory mask requirement is still in effect and has not expired. All citizens are required to wear a mask in public to protect themselves and others. In an effort to keep our emergency departments from getting inundated, we encourage, like the judge mentioned, for COVID-19 positive persons needing medical attention and or advice regarding COVID concerns to call the outpatient clinic at 826-8019 to make an appointment. This clinic is open Monday through Friday, 8 to 5. In an effort to vaccinate the community against seasonal flu, the health district is offering free flu vaccines. The next free flu vaccine drive-through is Thursday, November the 19th from 9 to 4 at the health district. To get a free flu vaccine, you can register at fluvaccine@cctexas.com, or you can call the immunization clinic at 826-7238. Starting November 23rd, next week, the health district will change its normal operating schedule to Tuesday to Saturday from 8 to 5 p.m. This change in schedule is to better accommodate citizens who usually work Monday through Friday to have access to COVID-19 services and mass vaccination clinics on Saturdays when the COVID-19 vaccine does arrive and become available to the public. There are now 2 vaccine candidates that have announced their COVID-19 vaccines are over 90% effective. This is extremely promising news to lessen the spread of COVID-19 in our community. In preparation for mass COVID-19 vaccine efforts, the Department of State Health Services and Health and Human Services are looking for COVID-19 vaccine providers. Any facility or organization or physician that is licensed to administer vaccine or provide vaccine services is eligible to enroll. Providers are encouraged to enroll at enrolltexas.dshs.texas.gov, and that's on the slide. You can also call the 877-823-7750 if you have questions. Over the past few weeks, the health district phone calls have increased. Most of the calls are from residents who are symptomatic or people that were exposed to someone from their workplace or large gatherings. The details from the workplace exposures reveal that employees continue to go to work sick or while waiting on test results. These are very unsafe practices that have proven to cause widespread transmission of the virus. Anyone who is sick or exposed to someone sick with the virus must isolate themselves and not be around others. If you have been exposed to someone who is COVID-19 positive, you must quarantine for 14 days. A negative test result within that time frame does not exempt you from completion of the entire 14-day requirement. It is always better to stop the transmission of the virus with one employee out sick than have your entire organization closed due to an outbreak. So the holiday season is quickly approaching. As with all our celebrations this year, Thanksgiving activities will have to be altered to keep everyone safe. Large gatherings with people outside of your household pose one of the highest risks of spreading or contracting COVID-19. To help you enjoy Thanksgiving 2020, we recommend the following. And we agree completely with what Judge Canales mentioned as well. Planning your holiday, don't go running around town without a plan. Invite only immediate family members this year. Be extra careful this week prior to your celebration and encourage your family to do the same. Do not practice risky behavior. Consider virtual activities if you have people that are vulnerable in your family. Avoid shopping in crowded spaces, especially during peak times like Black Friday. Prepare meals for family and friends and deliver them contactless. Anyone who is sick or is in quarantine, refrain from attending a celebration with other family members. Following these guidelines, along with your 3 W's, wearing your mask, watching your distance, and washing your hands often, as well as disinfecting commonly touched surfaces, not touching your eyes, nose, and mouth with dirty hands, can help us have a safe and happy Thanksgiving. Let's give thanks, stay informed, and stay healthy. nuecasknows.com. Thank you very much.
En las últimas 24 horas son 78 los casos positivos reportados en el condado de Nueces. 20,957 pacientes se han recuperado por completo. 105 personas continúan en el hospital. 33 están en la unidad de cuidados intensivos. 915 son casos aún activos. Hoy se reportan 0 fallecimientos. A la fecha, los fallecimientos totalizan 466 personas. A medida que entramos en la segunda ola por casos positivos durante esta pandemia, es de suma importancia evitar la propagación del virus y agradezco a las personas que hacen de su parte para evitar más contagios. En julio, el gobernador emitió una orden obligatoria para la utilización de cubrebocas en todo el estado. Este requisito aún está vigente. Para las personas que son positivas al virus y tienen preguntas, el número a llamar es el 826-8019 en la clínica ambulatoria, la cual está abierta de lunes a viernes de 8 a 5. En cuanto a la vacunación contra la influenza estacional, el Distrito de Salud ofrece vacunas gratuitas. La próxima campaña gratuita es este jueves 19 de noviembre de 9 de la mañana a 4 de la tarde. Para obtener una vacuna gratuita contra la gripe, regístrese en fluvaccine@cctexas.com o llame a la clínica de inmunización al 826-7238. A partir del 23 de noviembre, el Distrito de Salud cambiará su horario de funcionamiento normal de martes a sábado de 8 de la mañana a 5 de la tarde. Este cambio en el horario es para que más residentes aprovechen la toma de especímenes durante el día sábado si es que laboran durante semana. Actualmente existen 2 compañías farmacéuticas, las cuales podrán contar con una vacuna con más del 90% de efectividad, y para poder suministrarlas se está buscando a proveedores de vacunas. Cualquier instalación u organización que tenga licencia para administrar vacunas o proporcionar servicios de vacunas es elegible para inscribirse. Los proveedores pueden registrarse o llamar para más información al 877-823-7750. Recientemente, las llamadas al Departamento de Salud han aumentado, especialmente de las personas con síntomas del virus. Muchos de ellos son personas que han ido a trabajar enfermos y se han visto expuestos o han expuesto a compañeros de trabajo. Una persona enferma con el virus debe aislarse y no estar cerca de otras personas. Si ha estado expuesto a alguien que es COVID-19 positivo, debe ponerse en cuarentena durante 14 días. Durante la temporada de celebraciones le pedimos tomar acciones para evitar contagios. Entre estos, planifique sus vacaciones, invite solo a miembros de la familia inmediata, exhorte a sus familiares en tomar precauciones, considere actividades virtuales, evite comprar en tiendas abarrotadas, prepare comidas para familiares y amigos y entréguelas sin contacto personal. Cualquiera que esté enfermo o en cuarentena, absténgase de asistir o ser anfitrión de reuniones. Y recuerde, use su cubrebocas, lave sus manos con frecuencias y mantenga su distanciamiento social.
Hi, thank you. My name is Dr. John Lucens. I'm a member of the Nueces County Medical Society, a resident in Nueces County, a father, psychiatrist here in Corpus Christi for 7 going on 8 years. Been asked to come to speak to the City Council about my experience and also my understanding and explaining what pandemic fatigue is. It's a recognized term. It's not something that is made up as another part of what this pandemic can be. It's not an official diagnosis as recognized by the American Psychiatric Association, but what it is very true and real. So I thank the council for having me here to speak. Thank you, Joe McComb, Mayor, and thank you, Judge Canales. Thank you, Annette. First off, I greatly appreciate Dr. Freudian slip of saying Judge Canales there, of going over everything about mental illness. And what she said was absolutely true. The behavioral health experts in town, the psychiatrists, the nurse practitioners, the PAs, the family practitioners, the internists, we've been seeing higher and higher rates of depression and anxiety, substance abuse since March. And the points that she had were extremely well received and absolutely true. I think that reaching out to loved ones, I've spoken many times on news channels and also in my clinic in other areas to my patients every day about everything that she said. Today I won't go into that aspect. Instead, what I'll talk about is what we're going through and why I'm here. So, the numbers are obvious, as you see. We've had rising levels. We thought that we were skating through this. I remember when it first came over, I'm sure that some of the members of the community heard, Texas is going to be okay, particularly South Texas is going to be okay, because it's hotter. And the virus doesn't do well in the heat. Well, it's not true. Look at El Paso right now. Also heard that, hey, once we get over that hump, they'll be fine, it'll be gone. We just wait for a vaccine, herd immunity. Didn't happen. It's not happening. It's not true. Unfortunately, we're at a precipice. We're at a point now. However, this is coupled with what pandemic fatigue is. And that truly is a public weariness and a growing tendency to risk the known dangers of the coronavirus, particularly out of your own desire and necessity, your own selfishness at some point. And I will say that because at some point in time, you make a choice with that to follow the guidelines or give in. Now, with no end in sight, however, with some of these vaccines in sight, that's not exactly true, but we don't know. And I'm sure there's a public suspicion, there's a public concern, like any vaccines, that are they going to work? Who's going to get them first? I'm already getting that question from my patients. Are you going to get it, doctor? And the answer to that question is yes. Now, many people are now going out to bars, going to family parties, bowling alleys, sporting events. We see that on TV and across different states. It's hard because we have our own restrictions here. We see across the United States different restrictions. There hasn't been a central message from different levels of government to say what is right and what is wrong. In Nueces County, the messaging has been consistent, and the mandate has been consistent. But then you look on television, you see what's going on. So this leads to more of this fatigue that I'm talking about. Of course, people return to school. You hear about the work in the communities that you have to go, and we hear about resuscitating our economies. Now, how do we see the fatigue? What's one of the biggest indicators so far, besides our own internal feeling of it, and why am I still dealing with this? Just look to the rituals that we had in the beginning of this. The hope, the unity, these things that help people endure that first surge. Well, that's given way to exhaustion and fatigue. To quote some of my patients when I was asking about this, people are done with drawing on the grounds or putting up one saying thing. There was something called like scavenger hunts in certain neighborhoods, and you drive by and you have to look and see what what you could find, teddy bears in windows and things like that. They've taken them down. My own part that I see is on some of my favorite news channels, even in Nueces County, when they say, thanks for the first responders. It's the same people that have been on there. They used to switch up at least the providers and the firefighters and the police, and it's the same ones that are on there and I know some of those people don't even work at those places that they're listing them anymore. We're all tired of this. Now, the apathy and that huge sacrifice that we've talked about, it's coming at a cost and an exhaustion, a mental exhaustion, regardless of where we are. And this is not just for the United States. WHO is talking about this as well. All across Europe, the Asian countries, this is not just our fatigue. This is a world fatigue, because this is a worldwide pandemic. Now, if the spring was characterized by the horror of it, the horror of 1-2 cases. And I remember watching, oh, right, there we go. We've got 1 case in Nueces County. Now the fall here and the winter is an odd mix of resignation, heedlessness. People would not leave their homes. They just order in. We've got great companies now like Shipt and Favor, and I'm not paid by any of those, but they're great companies. People are now going to restaurants because they just want to get out and eat. Losing patience, slipping in a meal before the pandemic hits again. However, that causes the rise in the pandemic. But it's understandable. Of course, people are still doing their job. People are still fighting. People are still supporting each other and wearing masks and making resources available. But look for it. When you come out next time and you walk around, do you see the chalkboards? Do you see the things, those little things you put on in picket fences? I haven't seen them. So, and of course, this leads to where we are. How are we transmitting now? Before, you used to be able to identify that meat plant or that the congregation of a party or a church or a wedding. Now, and what we're coming up against in Thanksgiving, in the holidays, and why I'm here and asking you to recognize the fatigue and to fight the fatigue is because now the contact has spread so much, we're not looking at single events. We're looking at every person coming back, every person possibly at your event, every person who you don't know where they were in the last week. And the fatigue plus that is deadly. A family just told me the other day, how did they get it? How did they come in? Well, we went to a birthday party. We shouldn't have, but we were tired. My kids haven't gone to a birthday party in forever. We went. Got it. And I think it was Judge Canales that brought up kids coming back from college. It can go either which way. I can't go back to New York to see my mother. She's closing her house after all these years. I'm going to miss that. But what's more important? Her staying alive, and I want to go. I'm not immune to this just because I recognize what fatigue is. I want to go. I want to see my loved ones. But I want her alive too. Now, the loud majority has been successful in pushing back against any public health necessities here. They've taken a singular frame of mind that I've been inconvenienced long enough, and I'm done. I'm done changing my behavior. Begging you, the Nueces County Medical Society, me as a psychiatrist, a doctor, the resources, the government, the administrators are begging you, you can't give up now. And if this is because of mental health, we are here. Alcohol sales is not there. However, they have surged 23% during this pandemic. Of course, that's anxiety. That's drop-in drinks being sold in restaurants, but that's a lot. Overdose deaths, both here in Nueces County, here in Texas, and across the nation, have risen far more than any other weeks. So, what do we need to do? As a community, we need to come together again and convince people to make those steps all over again, just like we did before, that we saw that downward path. Once again, to spread that, to stop, spread the knowledge, stop the disease. So, this false sense of complacency that we did, it's harder to get back to. It's harder to go run back into the battle. But please, wear your mask. Do it for a veteran. It's a strong sense of pride in Texas for veterans, service members. Pick something. Do it for that reason. Wash your hands. Do it for your father. Social distance. Your mother, your grandmother. Do it now, or this could be their last holiday. Thank you all.
El día de hoy quise hablar sobre la fatiga o el cansancio de la pandemia. Este no es un diagnóstico reconocido. Hemos visto un aumento importante de personas con problemas de salud mental, personas que cuentan con depresión o que abusan de alcohol o drogas. Al principio se había escuchado que el virus no sobreviviría en nuestra área debido al clima cálido, pero eso no es verdad y la tendencia va en aumento. Esos aumentos pueden ser en parte cuando una persona no está tomando sus precauciones. Ahora muchos pacientes se preguntan ¿quiénes van a recibir la vacuna una vez que esté disponible? En cuanto a los bares, estos también ya han reabierto, así como las clases en persona han resumido. Mucha gente ya está cansada de escuchar lo mismo y el cansancio es mental, pero este cansancio no es local, es en todo el mundo. Todos los países lo están experimentando. Mucha gente se ha resignado y deciden no salir de sus casas o por lo contrario, están saliendo más por estar cansados. Esas acciones pueden causar más contagios. Los contagios ahora pueden ocurrir en cualquier lugar, en cualquier evento, no solo en un lugar en específico. Yo sé que la gente está cansada de lo mismo, pero yo le pido que no baje la guardia y continúe tomando sus precauciones. Lo que debemos hacer como comunidad es continuar tomando sus precauciones y así detener esta enfermedad. Por favor, use su cubrebocas, hágalo por alguien, por alguna razón. Lave sus manos con frecuencia por algún familiar o por alguna persona y mantenga su distanciamiento social. Ahora el reporte de la Universidad Texas A&M.
Good evening, everybody. My name is Dr. Chris Bird. I'm here on behalf of the task force. We have two objectives on the task force. The first is to address public concerns and questions about COVID-19 and the interventions that are taking place to combat the spread of COVID-19. And secondly, to help to enable evidence-based decision-making on the parts of our local leaders, hospitals, and other organizations. And for everybody listening now, for your Thanksgiving plans. There's several interventions that are in place right now. If you're susceptible to high risk of COVID-19 negative effects, then you should stay at home if you can. Wear face coverings and social distance. We've heard several times that these laws are still in effect for Texas. Isolate when exposed or symptomatic. So what this means is, for example, we heard about some people that were waiting on a test result and then going back to work. That would be exposed, and you want to self-isolate in those situations. And if you're symptomatic, again, probably you want to wait until you get the results of that test. There's a partial remote schooling order that's in place, so not everybody is going to school. There's remote schooling happening, and we'll have to work on the slides. I guess something has changed from before, but we'll get these fixed next week. Lastly, we're in the most open phase of Open Texas that we've had since the pandemic began. We were in this once in late May and early June, and that led to the summer outbreak. And now we're in the same level of openness where 75% capacity at businesses is acceptable and 50% capacity at bars. But we all know that the bars are open whether they are or not, whether we're in that Open Texas phase or not. So we're extra vigilant, and unfortunately, it looks like we're headed up the curve again. So this is what the projection looks like for this week. This is the new cases per day. The real data are the points. The projection is the line. There's no change from last week. Again, the transmission rate is projected to be 1.8. That means for every person that gets infected, they get an additional 1 to 2 people infected. And with that level of spread, it's very high. It's 1.8 doesn't look like a big number, but it's much higher than the transmission rate of something like the flu. And so with this transmission rate, if we continue along the same path, which we probably will unless we change our behaviors, and from last week, I gave a very impassioned speech last week on this. It didn't make any difference. We're still at 1.8. So I believe in myself a lot, and I want to believe that I can change the way that 600,000 people are going to behave. But I don't know if that's going to happen. Maybe you guys can prove me wrong this time. So anyway, this peak, it looks like it's going to be higher than the one over the summer. So last week I talked about this is kind of like looking at a Category 5 hurricane in the Gulf. Only about 68 people died in Hurricane Harvey, and I know that that's a lot, but we had over 700 people die from coronavirus in the coastal bend so far this year. And we're looking at another number equivalent to that, another 700 people potentially dying. In terms of hospitalizations, we're looking at an increase that's equivalent to what we saw last time in the summer, where the hospitals were very stressed. Here's the difference this time. There's a lot of other places in the United States that have huge outbreaks going on. El Paso is maybe the closest one. The FEMA nurses are leaving the local area, and the FEMA doctors are leaving the local area, and they're going to other places. And there's no saying that we're going to have that extra support that we had in the summer when we get into December if we keep going the way that we're headed now. So this is a real large concern for us right now. We're predicting a large strain on the hospitals. And again, with the fatalities, we're looking at this to rise equivalently in the future. And it's already started to tick up a little bit. In each of these graphics, you'll notice that the data fits the projections pretty well. Here, we were underestimating how many people are in the hospital. I want to point out here what was happening is that basically, if there was any concern about your health when we're in this area, you're more likely to be admitted as an inpatient to the hospitals during this time than back here. And you can see that we're now starting to track up with the projection. And as the hospitals become more and more burdened, then the probability that you'll become an inpatient if you contract COVID goes down, and that's not a good thing because then you're getting a lower quality of care. So that's something that we're trying to avoid here. And you don't have to look very far to see evidence of a fall outbreak beyond here. I know the numbers are low right now, but exponential growth sneaks up on you. In Laredo, they're almost as high as they were in the summer in terms of number of cases per capita. And these other, again, this is kind of a little messed up. I'm not sure what's happening when I give the slides over here to the city, but we'll get that fixed. Victoria going up, San Antonio going up, Nueces, we're right here going up. So it's not looking good. And when you look out at all of Texas, basically the whole state of Texas is increasing, with the exception of Amarillo and El Paso and Lubbock, where they've already peaked out at a level much, much higher than where we got in South Texas in the summer. It's almost twice as high in terms of the numbers of new cases per day per capita, what they were seeing in El Paso, Amarillo, and Lubbock overall. And there was even a day in El Paso where there were 3,000 new cases in one day. If we had that same level here, it would be 2,000 new cases in one day. Now, we haven't seen anything like that, and I hope that we don't. But this is what we're seeing in other places in Texas. So with that, let's talk about Thanksgiving 2020. And we have some tips here. I pulled most of these from the CDC's website, as well as the graphics. Avoid travel if you can. I heard talk about not going to New York. You kind of can't go to New York. You'd have to fill out a travel form to even get into the state. And it's very difficult to go there. I learned that my dreams of having a ski vacation this year were going to be impossible because you just can't get to a place that has snow, and then I don't have time to quarantine for 14 days before I get out on the slopes. So there's travel restrictions. Be careful of that if you're traveling for Thanksgiving. If you have to travel, make sure you have your flu shot. Make sure you mask up. Make sure you wash your hands. And don't touch anything. Don't touch your face when you're in the airport, things like that. Try to avoid that. Okay, another idea to protect the vulnerable, you could make dinner and bring it to the house of your elderly family members, drop it off, contactless delivery, and then you can have a virtual Thanksgiving. So this is something that I've heard people talk about, and the CDC is recommending that you do that if you can. You could also share recipes. I saw that on the website that Judge Canales shared. If you must gather, try to go outside. If you can't go outside, open windows. Make sure that you have good ventilation. And good ventilation doesn't necessarily mean turning on the air conditioning. It does mean if you have sterilizers in your air conditioning system, that could certainly help. Air purifiers that kill viruses, that'll help. Opening windows, that'll help. BYO, this is something I didn't think about that's on the CDC website. Bring your own food, bring your own drinks, and then celebrate together. That minimizes the risk of transmission. And definitely don't have a buffet. It's not a good idea to have a buffet this year because you don't want multiple hands in the same plates. Try to keep those separate. And lastly, obviously, wear a mask and social distance pretty much regardless of what you do. And wash your hands. I'll leave you with some advice on curbside pickup while you're shopping. I think it's well known at this point that I love curbside pickup. I never want to step foot in a store again. This is the best thing that's ever happened to me in terms of shopping. You can, rich people, they don't go inside of supermarkets or into Walmart, right? They have other people do that for them, or it's brought to their house. So this is like we're rich and famous. So here's some highlights for curbside pickup. One, you can order online, and I know the first time is kind of tough, but after you ordered once, you just reorder. It's super easy. 2, contactless payment, so low risk of COVID. 3, you can surf the internet while waiting in the parking lot instead of navigating through crowded aisles with carts and people clogging them up. It's especially bad here in Texas, I've noticed. I lived in a lot of different parts of the country, and clogged aisles in the grocery store is a Texas phenomenon more than any other place I've been. With curbside, you don't have to deal with that, and you never pick the wrong checkout line when you do your curbside. And lastly, I want to recognize some of the places. I know that the inset's probably covering the locations, but I go to curbside all over the place in Corpus Christi. Sam's Club, by far, has the best curbside service, bar none, and they gave free cupcakes and a Red Bull this week, which was fantastic, solidifying their position at number 1. Number 2, HEB, great place to get your Thanksgiving meal items. And 3, I know that we don't want to encourage overindulgence, but Specs has a great curbside system. You can order online and you can pick up there without going inside the store. So Sam's Club, HEB, and Specs, great local locations that you can go to and get great curbside service. And with that, we'll go to a translation and we'll take any questions that we have from Facebook Live.
Las intervenciones no farmacéuticas continúan vigentes. Siga tomando sus precauciones. El pronóstico para mediados del mes de diciembre se prevé estará de igual manera que durante el verano. El radio de transmisión se encuentra en 1.8, lo que significa que una persona infectada puede contagiar a 2 adicionales y así sucesivamente. Las hospitalizaciones también se pronostican van a aumentar significativamente. Desafortunadamente hemos perdido a muchos enfermeros viajeros por parte de FEMA que se han desplegado a otras ciudades con brotes importantes como la ciudad del Paso. Otras áreas del estado van a continuar experimentando crecimientos grandes y rápidos por casos positivos. En cuanto al Día de Acción de Gracias, el Centro de Control de Enfermedades sugiere evitar viajes. Tenga cuidado si sale a visitar algún lugar, pero si tiene que salir, se le pide vacunarse contra la gripe y continúe tomando las medidas de salubridad. Si se va a reunir, hágalo de manera virtual, pero si no lo puede hacer y tiene que reunirse con sus amigos y familiares, hágalo en un lugar con buena ventilación o al aire libre. Lleve su comida personal, pero algo muy importante, no ofrezca comida de manera de buffet. Continúe ordenando comestibles para recogerlos afuera de la tienda, así tendrá menos contacto con más gente.
Facebook users have a few questions today. One of them for you. If the mask works so well, why the surge? People not wearing correctly, circulation, why do you think?
Maybe repeat the question back to you to make sure I've got it. Why are we seeing another surge?
If the masks are working so well, the question was repeated.
Okay, yeah. So if the masks are working, why are we seeing a surge? Well, it's simple. Not everybody is wearing masks all the time. Number two, masks aren't 100% effective. They don't make you Superman or Superwoman, but they do substantially reduce the risk of transmitting COVID. Now, here's the thing. You may have noticed that we've gotten pretty darn good at predicting what's going to happen with COVID. And the only thing that we're really using now to do that is the way we behaved in the last outbreak, number one, and two, the state's mandate on what percentage of capacity businesses can be at. And it doesn't even matter if bars are open or not, because the bars are open anyway, even if they're supposed to be closed, because they just stay open under where they sell 51% of their proceeds as food instead of alcohol. So basically, when you go out to a restaurant, you don't eat while wearing a mask. So a mask isn't going to work then. In El Paso, where they're having a huge outbreak, much bigger than the one we had here in the summer, 50% of all infections that were traced by the public health department there were traced to restaurants or big box stores. Now, I don't have an explanation for the big box store. Maybe some people there aren't wearing masks the way we do here. I have noticed that there's pretty good mask compliance in Corpus Christi when I'm waiting in Curbside and watching people go in the stores. But then again, I think that I myself got coronavirus while wearing a mask, so it is possible to get it. And if you touch your eyes, you can get it that way. It's possible to get COVID just through the air, touching your eyes. Like, you don't touch your eyes, the COVID could land on your eye, and you can get it that way. Remember, COVID is aerosolized, and wearing glasses does provide some level of additional protection. So there's all sorts of ways you can get COVID. But if we weren't wearing masks and we weren't doing anything to try to stop the spread of COVID, the outbreaks would be much bigger, the hospitals would be overrun, and we would increase much faster than we are. So the transmission rate's only 1.8. It could be up to 3.3. And so that's my long-winded answer to that very short question.
Oh, thank you. This may be a question for you, Annette. Has the county already contacted all the positive cases from today's drive-through testing? Which I guess that's a question of how quick are the results.
Right, they're actually doing that as we speak. So we call every positive, and the negatives, we reverse alert them. So the negatives will automatically get a reverse alert that they are negative, and the positives are being called as we speak.
There's another question about how many people died from COVID that were on hospice?
They were on hospice. Well, that's interesting the way that question is asked. How many people died that were on hospice? It's actually kind of sometimes the other way around. So they have COVID, and now they have comorbidities, and now they're placed on hospice. And so there are a number of people. I don't have the exact figure, but I can go back and look.
And adding on to that, the state of Texas has very stringent qualifications for what constitutes a COVID fatality. You can have COVID on the death certificate. If it's not the #1 cause of death, that's not a COVID death. So the only fatalities that get called COVID fatalities are the ones where the primary cause of death was COVID.
And that's all the questions from Facebook. Thank you.
Thank you. So seeing no other questions, thank you for being with us this evening, and we will see you again next Tuesday at 5 o'clock here in the chambers. Thank you.